The next hold we would like to show you is the so-called rugby hold. It's called rugby hold or American football hold because effectively you're holding and supporting your baby like a rugby ball or an American football. This position can be very helpful for if you've had a cesarean section, so that the pressure is taken off your cesarean scar, because you'll be moving the baby around and the baby will not be resting on your tummy. This position is also very good for very small babies or premature babies because you can give them a little bit more support in this position. It's also very good for mums who have very large breasts, because the breast is not going to fall onto the baby, and also you have better visibility, so you can see better what you're doing. This position can also be very helpful if your baby favors one side. So let's say if your baby is very comfortable feeding on this side in the cradle or cross cradle hold, but then when you turn your baby around to feed on the opposite side, they for whichever reason, sometimes it's the positioning from the womb, that they then struggle a little bit on the opposite side. So if you've been feeding your baby in the cradle or cross cradle hold on the one side and then offer the rugby hold, they effectively stay in the same position, and you can trick them into thinking they're still on their favorite side. So it's very useful. It's also very useful to change positions around in the early days, so your baby accesses the breast from all around. And as we said before, that when the baby is transferring milk, the chin is compressing the ducts and the chin is effectively draining the breast, and that's how they take in the milk. So wherever the chin is positioned, the breast is best stimulated and also best emptied. So in the early days, when you're still stimulating your milk supply, it's good to offer the breast in different positions. And also if you feel a little bit fuller in one side, so often as the milk comes in, because we've got lots of ducts in the outer quadrant, in the outside, it's helpful to position the chin in that way so that you can effectively empty the breast. It's also very helpful to change up positions if you're already a little bit sore, so that your baby is not always compressing the same spot. So getting used to lots of different positions, breastfeeding positions, can be very beneficial for you and for baby. So what usually needed for the rugby hold is a good support for your elbow, because your hand, your arm is actually holding baby in place. So you want to have some props for you. And it's always like, as we said, with the principles of chin, C for close, you want to keep your baby close. So the support is not to put baby down on, it's actually to support your arm. And you keep baby in place. So you can use a breastfeeding pillow, or you can just use any ordinary pillow or cushions to just prop yourself up, so that you can sustain this position for a good while. Then again, we go back to this. Oh, you're so patient. We go back to the same principles of keeping baby close. Also, we go back to head free. So we go back to that hold, and it's really helpful to even practice that when baby is asleep, or try practice it beforehand with a doll. So you want to make that C shape, cup baby's neck and shoulders just under the nape of the neck, so the head is free. And if you really support them like that, their head's not gonna fall. Yeah, it's going to be slightly extended, but it's not gonna drop or fall. So then again, you use your elbow and really clamp baby's bottom under your elbow, but this time you wrap them round like a belt, and the legs go behind you. So the legs go behind you, so it's good to have maybe support for your lower back, but keep a little bit of room behind your back to put baby's legs around.